Hello everyone, welcome to the next episode of Supply Chain Redefined with me, Prabhu. Today we are in a special place. Hope everyone still remembers COVID-19.
China has identified the cause of the mysterious new virus.
Coronavirus.
The first US case has been detected.
There's confirmation the coronavirus has reached Australia.
China is urging its citizens not to travel abroad as it struggles to contain the virus.
We will be standing up Christmas Island as a quarantine area.
Foreign nationals coming from China are now banned from entering the country.
I have today declared that the coronavirus presents a public health emergency in the United States.
It's a very big pandemic that affected the entire world and it cost a lot of lives. So there was a company, one of the company which helped us thrive the COVID and it helped us come out of COVID. It's none other than Clorox. So we are going to talk to the people from Clorox and understand how COVID-19 affected the entire world and how Clorox navigated the demand and what's the lesson learned from COVID-19. We have a lot of questions to ask with Rick, who is the former Global Supply Chain Officer with Clorox. Let us ask the questions with him. Hello everyone, welcome to the next episode of Supply Chain Redefined with me, Prabhu. I'm happy to have an interview with Rick McDonald, former Global Supply Chain Officer with Clorox Company. And I have a lot of questions to ask to you, Rick, about how you handled the global pandemic and how Clorox handled the pandemic, because like you guys played a bigger role in the supply chain, right, on the Clorox.
Yeah.
So I want to discuss with you on how did you handle and what is the lesson learned. And how are you prepared for the future if anything, nothing happens, but if happens, how are you prepared?
Yeah, that
Happy
sounds
to
good.
meet you.
Very nice to meet you as well. It's great to be here, and I'm honored to be on the program. Thank you.
Thank you, Rick. And before going into the topic, introduce yourself, like how you are with Clorox and how long you're with Clorox.
Sure. Well, I retired from Clorox September this year as the Chief Supply Chain Officer. I've been with Clorox for 32 years. A great run with a great company, and it was an exciting time for us, not only with COVID, but also hyperinflation.
Mm-hmm.
And then unfortunately, the company had a cyber attack about 15 months ago, and so I got to lead through that as well.
Okay.
And I've had roles up and down the supply chain, culminating in the Chief Supply Chain Officer role.
My next question to you, Rick, is when pandemic COVID-19 happened, what was your initial reaction and how did it affect Clorox supply chain operations when it happened?
Yeah, the initial reaction was really just a lot of concern for the human beings involved.
Yes.
We had heard from our colleagues in China, Clorox colleagues in China, that even before COVID was being reported on here in the US, that it was really a very serious thing.
Mm-hmm. Yes.
And so that was probably December of 2019,
Mm-hmm.
something like that. Immediately, we took up our 4 days of supply targets
Mm-hmm.
for all of our line items. And the theory there was, if it was indeed a serious global pandemic,
yes.
then we would have as much inventory as we could possibly make before it became a problem here in the US. If it wasn't, we had a number of weeks and months and quarters to run out that inventory, if you will.
Yes.
So we took a bet that, unfortunately, that it would be something important in the world. We were right.
Mm-hmm.
But even with all the production we made between January and April, by May, we were out virtually on every single item.
Okay.
The stock levels, the demand levels were 500% in
Wow.
some cases of our normal demand signal.
Yeah.
And, the supply chain just was not set up for that level of volatility and that level of acceleration of demand that quickly. We turned from a $6 billion company into a $7 billion company virtually overnight.
Wow, that's amazing, right? Like it's good in one aspect, but the other aspect, like a lot of demands coming across different places, and you need to make sure you feed enough demand to different stores and stocks, right? So that's amazing.
That's right. And from that point forward, for the next couple of years, we were playing catch up. and really trying to restore our customer service levels to the typical 98.5% case fill rate performance that we were used to and historically had achieved. It was a real challenge over that time period as the demand kept increasing and staying at really high levels for the entirety of the pandemic.
Wow, amazing. My next question is, during pandemic, there was a huge demand on Clorox different inventories, right? Like, how did you manage the unprecedented demand? Even like personal experience, I felt in a lot of times, like when I go to the store, I couldn't get a Clorox wipes. So like, how did you manage that unprecedented inventory demand, and how did you prepare or how did you plan yourself for the demand?
Right. Well, the thing that we knew we had to do was run our plants as much as we could. And so we set up conditions in our factories where our employees felt like they could be safe coming to work. And that was really a key because we were deemed an essential business, and so we had to continue operating. And with the exception of a few days at one of our plants, we ran continuously through the pandemic. We also had to do everything we could to help our suppliers and our third parties, including our great partners here, DHL, do what they do to make sure we had the right amount of raw and packaging materials to run our plants, but also that we could facilitate the movement of shipments to our customers.
And most of the inventory you handle pallet in, pallet out, right?
We do. Probably in this facility, maybe 20% or so of the cases shipped are fingerprinted, so they're picked. But the rest of it's pallet in, pallet out. The biggest challenge was trying to get a handle on the demand signal. It was extraordinarily volatile, and if you recall that time period, the early thesis was, well, as soon as it gets warm, COVID will go away. That turned out not to be true. And then it's like, well, if we all wear a mask, that wasn't true either. And then when the weather gets cold, COVID will go. Well, that didn't turn out to be true as well. And so we were constantly feeling like we were just on the verge of being able to catch up, and then the next wave of COVID would hit and demand would spike again. So that really put us into a continuous mode of trying to plan and replan. And to help do some of that, we went on allocation for a lot of our products. We built some bots in the background who help with that allocation to make sure we can get the right products to the right customers in the right part of the country. And all of that combined to make it as good as we could make it for our customers and our consumers.
Okay, yeah, because in few stores I even saw like one per customer, right? So at the time, like a lot of people might be focusing more on the store, but there is a huge world in the background fulfilling those inventory back to the store. So
yes.
It's amazing how you guys handle the COVID.
Well, thank you. And a story that involved one of our largest customers was shoppers would figure out when the supply truck was going to show up at a store. They'd go around to the back and wait for that truck. And this customer actually had to close off their receiving dock to keep people from being back there and potentially having safety issues. People were very interested in Clorox products, and of course we were trying to make as much as we can.
Yes, like there are a lot of inventories. People got it and sold it in Amazon or Flipkart, right? Like it was a huge demand at that time.
Yes, indeed.
So my next question to you, Rick, is when the huge demand started, right? How did you collaborate with the suppliers and vendors to make sure you get the inventory on time and you ship it on time? So how did you collaborate that with your vendors and suppliers?
Yeah, I'll just start with, there were several heroes in this story, the Clorox story over that time period. First of all, our employees. And just continuing to show up day after day after day, producing, in many cases, our life-saving products. Second of all, were our suppliers, and thirdly, our third-party logistics providers. They were heroes also. And I think the key to that was the strategic relationships that we had developed over time with a lot of our suppliers. And then the conversations that we had after that, really to collaborate on what could we do, how much could we do, how well could we do it in a very volatile and uncertain situation where all of us individually had our own concerns, never mind those of the marketplace and our customers and our consumers. And so it was a very challenging period.
Yeah, because like a lot of times I do remote working. So during COVID, I was so scared to come outside. So the people we are talking about, they came to the warehouse, they worked and make sure they send the inventory on time and get into the stores.
Yeah.
That's a you really need a huge guts to come out and work, right? So
Yeah.
I really appreciate those people.
Yeah, me too. Me too. It was an amazing time period and very inspirational. When we got into our plants or we talked to the folks who were working in the plants, they really viewed it as their mission to make products that could make people's lives better. And in some cases, with our disinfecting products, potentially save lives.
Yeah, I think one phrase I can remember is like, it's not a package, it's patients' lives, right? Like it's whatever you are fulfilling. It's not a package, it's patients' lives.
Yeah, that's right. That's right. And in some cases, we created entirely new forms of our products going to hospitals and medical care facilities.
Yes.
We typically would not ship anybody a tote of bleach, but a few of our plants figured out how to do that in a matter of just days. And we started shipping totes of bleach to these medical facilities, large medical complexes, so that they could use that in their spray bottles or as they were wiping down surfaces when they didn't have other products to use. So that allowed hospital operations to continue, surgeries to continue to the extent they had to be performed.
Yeah, that's another area, right? Like,
That's right.
where we need to fulfill and make sure they don't run out of stock.
That's right. Exactly right.
My next question, Rick, to you is like, this is an important question. How did Clorox prioritize its safety? Shipping the product, shipping the pallets is necessary, it's important. But at the same time, how Clorox prioritized its employees' safety and well-being?
Yeah. Well, first of all, we have an extraordinarily terrific culture around personal safety. We operate at kind of the world-class level in terms of number of people injured, and we don't think about it as the numbers. We think about it as the human beings who were injured in some part of our operation. So it's the first thing we think about as operators. And we were actually ended up with the best safety performance in the history of the company during the pandemic. When we were working a massive number of hours. So this foundation that we set, this culture that we have, carried through. But we allowed it to really blossom in a couple of ways. When the pandemic started, in the early days, we were just trying to do mostly what we were doing, all of it. And then it appeared that this was not going to be over in just a matter of weeks or months.
It took almost 2 years, right?
It took a long time.
Yes.
And nobody knew that, of course.
Yes.
But what I did is I said, we're going to streamline our objectives to two things, two objectives. One is we're going to keep our people safe and healthy, number one, at all costs. And number two is we're going to run our plants as much as we possibly can to make the products that are needed. We basically discontinued almost everything else that wasn't in service of one of those two things. And the other thing that we did about 6 to 8 weeks into the pandemic, Prabha, is we hired an epidemiologist. And, I'd probably put that into the category of right place, right time versus we had this plan to go hire an epidemiologist. But one of my team members, we were meeting 2, 3, 4 times a day, 7 days a week for months. Early in this time period, one of the people who reported to me came to me and said, hey, what do you think about hiring somebody who really knows how viruses work? I'm like, that is a great idea.
Yes.
So they happen to know somebody who is connected with the CDC. And I'm telling this story for a reason here, and I'll come back to the employee safety part in just a second. But we didn't go interview 4 other epidemiologists. We didn't conduct a bidding process. We hired Dr. Garrett. We put him on retainer like the next day. And what we learned from Dr. Garrett was all the things that we could do to give our people confidence to come to the factories and to be able to work safely. As an example, when companies were scrambling to find the handheld temperature taking devices, we already had ours.
Yes.
We had ours. We knew that was coming. We knew that was going to be a thing. Same with masks. And there was a lot made of running out of masks. We already had a supply. Social distancing, we got ahead of that. And it gave our employees a lot of confidence that when they came to our facilities, they were going to be safe and they were going to be healthy. They'd have their best chance. And we had no instances of transmittable COVID inside our facilities during the entire COVID period. Now, did people get COVID? Yes, they did. But they got it someplace outside. They went to a wedding, they went to a friend's house, they went to a party, they did something else where somebody had COVID and they picked it up there. None of that got transmitted in our facilities. And I think the work that we did with our epidemiologists to really be very thoughtful about how to do that first thing, keep our employees safe and healthy, that mattered a lot.
Yeah, and one more question though, like, so how did you convince the workforce, right? Like, so you might be seeing, you might have seen like people 50-50, like, okay, I want to come to a office or I want to come and work. Some people like, no, I'm not coming
Yeah.
because at the time there was a huge fear on the virus. So
Absolutely.
how did you convince the workforce and created the confidence that yes, we are with you?
Yeah.
So how
Yeah.
did you create that
It's a
confidence?
great question. One of the things we did was we talked about these things that we were doing to keep them safe, taking temperatures, having a rigorous protocol for who could come in our plants, enforcing the mask edict, making sure social distancing was executed well in all of our facilities. But past that, one of the really great things that our corporate HR group did in concert with the rest of the leadership team of the company is we created this program where if people did not feel well, they didn't have to come in and we would still pay them. We would still pay them.
That's awesome.
And so it gave people the right, I guess, if you will, to stay home when they were not feeling well, because we didn't want them transmitting whatever they had to
the entire
two other
workforce,
people,
yeah.
10 other people. And it worked out really well. And you might say, you know, if you're a bit of a cynic, it's like, well, that's right for people to take advantage of. We had a few people that did, but for the most part, it was a very well received and very well executed program where people, if they did not feel good, they didn't come in, and as soon as they did, they came back in.
That's so nice of Clorox.
Yeah. Well, it was, I mean, honestly, I think it was really essential to what we had to do as essential business to keep running. We had to create that context, that environment where people felt like they were covered one way or the other.
Nice.
Yeah.
How are we planning for if any new pandemic comes, how are we planning to be ahead on the planning side, and how Clorox is having different plans in place to plan for any new pandemic or new surge in demand, like
Yeah.
how Clorox is planning, because like we have new variants coming every month or every 3 months, particularly during winter we are seeing a lot of variants,
Right.
and how Clorox is preparing for that.
Right. Well, I'll tell you a couple things that we learned during the pandemic. And, you know, I'd love to tell you that this was part of some, you know, plan that we had, but honestly, it occurred as things were occurring. We learned we didn't have to have perfect information to be able to make decisions quickly.
Yes.
You know, so many times you want to get the 2 decimal points to the right of the decimal place correct before you move.
Well,
We didn't have the luxury of doing that. We had to make decisions that we thought were in the best interest of our employees and of our customers and consumers, and do that without knowing, because there wasn't a lot of really good information about what the pandemic was or wasn't. And we applied that later on, especially during the recovery from the cyber attack. Number 2 is you really can't ignore any part of your supply chain.
exactly.
The relationships you have with your suppliers, how you work with your third-party logistics providers. Now, not all of them are strategic for you, but the ones who are strategic and everybody else who's transactional, you've got to have trust and a really good relationship to make things go during the hardest of times. And then the third thing was, we just realized that our supplier resiliency, you know, what we had done to cultivate a broader and more robust supplier base wasn't good enough.
Yes.
And I think a lot of people learned that lesson during and after the pandemic. We've applied it. The way we talked about it was an insurance policy. And you're not going to insure every single supply of every single item, but you are going to pick the places where you're most at risk, where you have maybe sole sourcing, maybe it's a single product made by a single company for an entire product line. You've really got to focus on your plan B for those types of items. And so coming out of the pandemic, actually during the pandemic and coming out, the development of the supplier community has really taken on a new life.
And I hope like you might have added more suppliers after the pandemic, making sure you have a backup plan of different suppliers, right? Like
That's right. Well, and the mindset for many years was you want to leverage your scale to get the lowest cost, and you assumed a service level that was acceptable to you. That was more a just-in-time philosophy. And now what it's all shifted to is just in case, and really kind of anticipating where you might have challenges going forward and shoring up those vulnerabilities through these supplier insurance policies.
nice.
Yeah.
Nice. My next important question is, how can supply chain leaders plan for any challenges that are unimaginable, and still there are a lot of challenges which has not been explored yet? How can supply chain leaders plan for it?
I think one of the biggest learnings, and the thing that the pandemic taught us is it is possible to have massive disruption in your supply chain. And not that people didn't think about that beforehand, but I think there's maybe not as much preparation for that. With that said, having an inventory of the biggest vulnerabilities that a leader has in their supply chains, that's step number one. What are those vulnerabilities? How significant are they? How material are they financially or reputationally to the company? And then the second one is, how do you want to attend to those? And there are lots of different ways to attend to those. You could build more inventory. You could build more raw and pack. You could reserve capacity. You could add supply. I mean, we all know the various approaches that we could take to build more resiliency to our supply chains. And I think what the pandemic taught us was we've got to have more of those ready to go right away for the next black swan, gray swan event that occurs. I was at a conference a few months ago, and one of the speakers produced a great chart that wasn't exhaustive, but it showed all of the notable disruptive events that have occurred over the last 10 years.
Wow.
It was a picture of the globe, and then points where these events had occurred, and some of them, of course, span the globe. And it was a massive list, and I think we can expect that to continue. And so what we can't forget about is how disruptive COVID was and what we have to do to be prepared for the next event like it.
Tell me about a moment where you felt inspired by the resilience of your team or partners during pandemic.
Yeah, there were so many of those. The supplier community was absolutely spectacular because they had to continue to run to support us. Partners like DHL, our carrier partners, our customers, like there was a very high level of collaboration to enable product to keep moving through the supply chain. And that didn't happen in every single industry and every single company. So the one that stands out for me probably is spring of 2021. We had trouble producing enough wipes with our line here in Atlanta, plus all the contract manufacturing capacity that we could find in the US. And so we hired one of our consulting friends to go scan the globe for wipes capacity. At the same time, we were building another highly automated Clorox disinfecting wipes line inside of the factory here in Atlanta, side by side with the one that was running while it was running. To do that, we had to have help from the White House Supply Chain Task Force and General John Palachuk. He connected us with the State Department, who were able to expedite visas for 170 contractors from Germany and Italy who followed the gear that we had bought and basically built the plant. Basically built the plant while we're continuing to run the line that we already had in place. And we got help from Governor Brian Kemp, the Economic Development Office here in Georgia. We had help from customs clearance, so all the gear could clear quickly. It was amazing to see how quickly things could work when they had to work quickly. And so meanwhile we're doing that, we met this new supplier offshore, and literally within 3 weeks of saying, hi, how are you? Here's who we are, who are you? They're making our EPA registered product.
While everything is running,
So we're importing container after container of these wipes. We've got this new line coming up basically 8 months after our board approved the funding, which is kind of unheard of for a highly automated line like that. It was just a really proud moment for me because we had this amazing need for these disinfecting wipes that save lives. And now we could make 4 times what we could make previously. And so it was a very satisfying moment. Now, we had to continue that performance on, but when you think about the significance of business and government, our suppliers, our third-party logistics providers, our consultants, how that all came together in a short period of time, it was pretty. It was a pride and inspiring moment.
How did you feel like when you saw the first box moving through the conveyor line? How did you feel?
It was unbelievable. It was unbelievable. And we've all started up manufacturing lines before, and the more automation, the tougher it is. It was a near vertical startup, and I think the folks who were working on that project, whether they were contractors for the equipment, the OEMs, or they were Clorox employees or other third parties, they took such pride in what they were doing and why they were doing it. The purpose behind their work was really the driving force behind the quality of the execution.
Yes, right. Like they should be really proud of what they have accomplished. Nice.
That's right. That's right. Yeah, they did it. They did a fantastic job. So that was a great moment of pride for me, and I was just really proud of all those who were involved.
It was nice talking to Rick. Thank you so much. You shared us a lot of information. This is really helpful for the audience. Thank you so much.
My pleasure. Thank you so much for having me.
Thank you. Thank you.
Thank you.